And today we join in to raise awareness of the AIDS pandemic brought on, of course, by the spread of HIV, and remember those who have lost their lives to the virus. And joining me now via Skype is licensed medical and family therapist John SOVEC, who's also a speaker within the HIV/AIDS community. Appreciate you taking time with us, John. Hopefully Thanksgiving was great, even though it is obviously a strange Thanksgiving, but hopefully you were able to spend some time with some loved ones. I want to get into really remembering, honoring, and trying to, I guess, educate about a pandemic in the HIV/AIDS in the middle of course, this pandemic. So how would you do that? How would you kind of put the two together? Obviously, World's AIDS Day on a day where we're all battling a new surge in COVID-19.
Well, I think it's really important for us to all recognize that, World AIDS Day is so important because we have been battling HIV for over 30 some odd years now. I mean, the first World AIDS Day was put together by the World Health Organization in 1988. And this is still a pandemic that we are fighting on a regular and continuing daily basis. It's not something that's gone away. It's not something that's disappeared. And unfortunately, it's not quite as newsworthy as it has been in the past. But there's still lots of people living with stigma, lots of people living with shame, and lots of people living with this virus on a regular daily basis. And I think we need to make sure and remember that.
How important is education to continue to talk about it? I'm of the age where I remember being a kid and going through school, and again, it was the biggest news at that time. We didn't have the medicine and the therapeutics that we have now, so it was, perceived as a death sentence. But here we are now, to your point, because people are able to live longer, live with it, seems like we don't talk about it as much. So what would you like to see on the education front about HIV/AIDS?
Well, I think what's really important to understand is that it is still present in our world. Currently, there are 1.2 million people living in the U.S. with HIV, 38 million people globally. That's a huge number of people who are living with this virus in their bodies. We're also looking at, though, a piece of education that's missing is the message has gotten diluted. The idea that we could basically eradicate this virus very quickly if we could get the message to continually be heard and implemented in the community. We know that of that 1.2 million people living with HIV currently in the U.S., almost 14% of them have no idea that they're actually carrying the virus. And that 14% is the piece that needs to be educated to understand that there are simple, safer sex practices. There are ways that we now approach HIV different, and that we actually could eradicate and end the transmission of HIV if we can get the message clearly sent out into the community.
John, let me ask you this. Ryan Blackshear-Vargas, we just aired a piece that she did about the daily pills that folks are taking to kind of be preventative when it comes to HIV. Tell us more about it, how maybe that's changed the game at all, and really, again, some more of its benefits, even though we saw Ryan's piece.
Well, here in the U.S. especially, if you have access to medication, HIV has become a chronic, manageable, livable, survivable disease. Once again, that is if you have the ability to access the medication and if your body is able to tolerate it, which for most people these days, we can find medications that will work in that way. If a person is really on top of their treatment, there's a really big education piece now that we call U equals U, undetectable equals untransmittable. So if a person is under regular care, if they're taking their medications in a regular, timely fashion, and their viral load, the amount of HIV that we can detect in their body goes down to a very, very low, undetectable level, that means that they're actually not able to transmit the virus. And this is a huge scientific breakthrough, and it really emphasizes the importance of getting on a medical regimen and following through on a daily basis to really eradicate the transmittable possibilities of this virus from one body to another. Undetectable equals untransmittable, U equals U is really a huge push that we're doing in the community right now.
John SOVEC, we appreciate you coming on, educating us, reminding us how important it is still to have this education in these conversations regarding HIV and AIDS on World AIDS Day. We appreciate it. Thank you very much, John. Be safe.